Hello, we are Team 7, and today we're presenting our project on optimizing bone scaffold regeneration by mimicking bone structure and utilizing host cells.
Annually, around 500,000 patients require some sort of bone repair or restoration in the United States. This being said, around 1.5 million individuals suffer due to bone diseases, such as osteoporosis, and one of the biggest issues from bone disease are fractures. This issue is expected to affect 1 out of 2 Americans over the age of 50, so it leads to an annual cost of over $2.5 billion, with a double amount near the year 2020 due to the baby boomer generation coming to a median age. When the patient has a fracture that is unable to heal itself, they will go through a procedure of having a bone graft, which requires a section of the patient's bone to be removed and then a 3D bone scaffold to be put in. There is a pressing issue with current bone scaffolds in the market as they have a strict geometrical formation, affecting the quality of the scaffold itself. So, as a theoretical solution, it is important to have a bone scaffold that mimics the pore structure of the human bone, allowing for a smoother fusion from scaffold to bone. It is important to fulfill the needs of a rheumatologist, for example, as they are part of the audience that will use the product to treat the patients in need.
In order to heal the bone, scaffolds are used to help bring new growth by providing cells, nutrients, and a matrix. Most bone scaffolds have strict lattice structures, which do not meet the same mechanical properties of bone. In order to improve upon current bone scaffolds, our design is meant to be an easy transition into the patient's biological system by mimicking the pore structure of the bone and utilizing host cells in the scaffold. This will optimize biofunctionality as the cells would recognize their similar shape in host cells, which allows proliferation. The cells above show a SEM of human bone tissue. Our group made the scaffold as similar as possible with different pore sizes using in topology. Our scaffold will be then 3D printed using a composite of HA, TCP, FN coating, and the cell serum simultaneously. Using 3 different nozzles, it avoids defects and flaws. HA and TCP are raw ceramics and show high similarity to bone minerals and mechanical properties of bone, which makes them biocompatible, biodegradable, and osteoconductive. FN is used to promote cell adhesion, and mesenchymal cells are used to give rise to new bone cells. However, our design is limited to technologies we have now, preventing a full mimicry.
During our benefits and cost analysis, we found that the values of our solution were that patients will not need another graft to replace the implant because of the increased functionality of the design. Increased induction of the material due to fibronectin coating, hydroxyapatite, and tricalcium phosphate, and patient cell infused 3D printing helps host cells adhere to the scaffold. Biofunctionality is increased due to the use of hydroxyapatite, tricalcium phosphate, and host cells. The increased function of the dynamic nozzle will reduce the need for changing the nozzle, which increases the time it takes to create the final product. Costs of the solution are estimated for the printer is around $150,000 for a 3D biological printer with present technologies. The cost of creating the bioink is roughly $500, which involves culturing the patient's cells, then placing them in an incubator, which slowly mixes the cells into an ink. Bioceramics, hydroxyapatite, and tricalcium phosphate can be purchased for $4.72 per gram, starting at $118 for 25 grams of the powdered reagent.
In the current market, there are a variety of alternative treatments for bone injuries and disorders. The first shown on the left is a cast. These are typically made from fiberglass or calcium sulfate hemohydrate, also known as plaster of Paris. In the middle is a bone graft. This is a surgical procedure where a region of missing bone is transplanted with new tissue to aid in regeneration and repair. Some different types of bone grafts are allografts, or tissues taken from a donor, and an autograft, where the host cell tissue is used in the procedure. Typically, the bone tissue harvested for the grafts are from the hip or ribs. The final image is a fracture fixation device. It uses a plate and screw to stabilize the bone during healing. The product shown is the VersaFix for femoral fixation, created by Zimmer Biomet. Shown are the advantages and limitations of each alternative. The leg cast and the internal fracture fixation only immobilizes the bone for the healing process. They do not have mechanisms to actively aid with the regeneration of bone. They are better suited with treating fractures where all pieces of bones are present. They cannot help with bone degradation disorders like osteoporosis, osteomyelitis, and osteonecrosis. Bone grafts can help with these disorders. However, it can be challenging to find large amounts of suitable tissue to use if there's severe degeneration. Since the device can be 3D printed to any size, It can treat patients that suffer with mild and severe bone degradation and loss. It is also seeded with host cells to avoid an immune response from the body, and a donor would not be required. Everyone, thank you so much for your time today and have a wonderful day.